Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about the relation between oral health and rheumatoid arthritis. Let's start. So today's a very important episode for me, and especially for people who are unfortunately suffering from the autoimmune disorder and disease known as rheumatoid arthritis. Now, rheumatoid arthritis is actually an autoimmune disease which has its origin in genetics, environment, and as well as infectious origin. It basically is a disease of the joints and the cartilage where it causes a lot of symptoms and pain and discomfort in patients' joints because of the fact that it ultimately starts to erode the joints and it makes the joints more stiff, and it can lead to definite loss of function and sometimes even permanent damage that can lead to a lot of compromise on the quality of life of the patients, albeit obviously the pain aspect, which is obviously going to cause discomfort. Now, it's very important to understand why am I talking about oral health and rheumatoid arthritis. It's because of the fact that rheumatoid arthritis has an inflammatory origin in terms of its pathogenesis. That means wherever there is a state of chronic inflammation, rheumatoid arthritis tends to flare up. There are 2-3 things that you need to understand apart from the fact that you need to know about the rheumatoid factor. Also, you need to know about the anti-citrullinated protein antibody, the ACPA, which is elevated in rheumatoid arthritis patients. This also causes some problems. Now, I have to be very honest, because of the fact that there is no causal variation between oral health and rheumatoid arthritis, but there have been some correlations or something associations. That means people who unfortunately have rheumatoid arthritis have xerostomia, that is dry mouth. They have TMJ problems, they have temporomandibular disorders, they have more periodontal disease, they have more cavities, they have more number of missing teeth, they have more number of bone related problems. So when I did the research, or when I did the paperwork for the homework for whatever I had to read, I found out that there is no causal variation. That means rheumatoid arthritis cannot cause oral health problems, but it can exacerbate them, and vice versa. So because of the fact that I've talked about periodontitis in a lot of episodes, and the fact that I've talked about the systemic inflammatory component of periodontitis and oral diseases, this thereby actually causes problems. So it has been found that the ACPA levels, again anti-citrullinated protein antibody, has been found to be elevated in rheumatoid arthritis patients, and it has been found that it helps in chemical mediation of inflammation in various parts of the body which are rich in collagen. So collagen rich body parts are actually your joints and cartilages, also your oral musculature and your gums and your teeth. So you need to really understand that there is definitely some sort of relationship between the two. However, it is not causal. Rheumatoid arthritis is actually seen more in women. It's compared to men, it's about 4:1 ratio. Secondly, what you need to understand is that because of the increased ACPA levels, it has been found on a molecular level that it actually helps in differentiation of osteoclast cells. Now, osteo means bone, clast means eating cells. That means bone resorptive cells. These cells which are used in dissolving and eating up of the bone of any part of the body are known as osteoclasts. So if you have ACPA levels because of rheumatoid arthritis, your ACPA levels are elevated. Therefore, it means that there is a possibility that you might have periodontal bone loss. And also one more thing that has been found out, because that rheumatoid arthritis is a crippling disease, you might have problems in your joints which can lead to a lack of proper oral hygiene because of the absence or the reduced dexterity because of the joint stiffness and pain. So it has been found that patients who suffer from rheumatoid arthritis are not able to maintain their proper oral hygiene, because of which they acquire these infections of the oral cavity such as periodontitis, because of the dryness which is seen. Xerostomia, that is dryness of the mouth, is seen in 50% of the patients of rheumatoid arthritis, and it has been found because of which they are more susceptible to cavities, they are more susceptible to oral health problems, they are more susceptible to burning sensation, and so on and so forth. So it is very important. Why am I creating this episode is very simple. If you are unfortunately a patient who is suffering from rheumatoid arthritis, my main concern for you is to control whatever you can control in the form of oral rehabilitation of your mouth. That means if you are having periodontal disease, you might as well get the periodontal treatment done, because that will reduce the systemic inflammation, and thereby it will help in somewhat, in a very indirect, on a very molecular or cellular basis. It's going to help in curbing and mitigating the flare up of your rheumatoid arthritis. And it's been recorded an abscessed tooth in a rheumatoid arthritis patient has actually caused the rheumatoid arthritis to flare up. So obviously there is something that is happening, there is some sort of connection that is definitely there. So you have to obviously treat the rheumatoid arthritis by visiting your rheumatologist, but also as a dentist and as your oral health expert, it is my responsibility to tell you and guide you that whatever sort of disease activity that might be happening in your mouth is something that you need to get control of, and you need to keep it under control, and you need to focus yourself towards better oral health. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message with your name, with your location, and your common oral health problem that's causing you discomfort. And if you have any queries, doubts, and apprehensions or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.